set a target of allocating at least 15% of their budget each year to the health sector, known as the Abuja Declaration. For more on the health sector, I'm joined by founder, Love for Health Organization, Dr. Yusuf Haroun, who's right here with me in the studio. Dr. Haroun, thank you for joining us. Happy New Year to you.
Same to you. It's a pleasure. It's you.
So even though we've made some gains, our healthcare system continues to face quite a number of challenges. There's inadequate funding, poor infrastructure, shortage of healthcare professionals, high disease burden, and what have you. Which of these issues do you consider urgent in 2025?
I'm going to talk about three main issues about it, and I would classify it as the good, the bad, and the ugly. Based on what you said, the most important thing is that there is a significant increase in allocation. Currently, President Tinubu in the fiscal year 2024 increased the allocation in the health budget to 1.3 trillion naira, compared to former President Muhammad Buhari, which was about 1.26 trillion naira. That's the good side. But the bad side is that it doesn't meet up to the Abuja Declaration.
Is there a far cry from it?
It's far, and that's where the ugly comes. It's a widening disparity or inequality compared to what is expected and what we have. So I would classify this scenario as the good, the bad, and the ugly. And I'll also give some future suggestions on how we can solve it in our discussion.
The Abuja Declaration recommended 15% of annual budget. We're now looking at 5.18% this year, up from 4.47% last year. But, you know, like we established, it's still a far cry from 15%. What do you think is happening? How do we invest more in the sector?
Now, it's surprising that the percentage we are allocating to health is decreasing. As you said, 4.6, 5 points. Even President Buhari's own former president was 5.75%. So we need to focus more. And what I think we can do in this is where NGOs, private bodies, or independent people come into to also salvage the health. A good example is what Sheyi Tinubu is doing, where he established 60 different healthcare centers in Nigeria, and he has targeted average of 10,000 indigenes monthly to supply with drugs. So we need more private bodies. We need more billionaires like that to support the government, to also put in health, and to also make health facility and health awareness and health accessibility easy. Also, I think that the federal government shouldn't just do everything. The state government have a lot to do. The local government have more to do, because healthcare is divided into the primary, the secondary, and the tertiary healthcare. So I think that it's not only the federal government that needs to do this. We even have to start from the primary healthcare centers, and they should focus more in providing health services to people.
As we speak now, official assistance coming from outside the country continues to decrease globally due to economic pressure. So countries prior to this time that usually that used to be big donors are now reducing how much they are giving out. In 2014 and 2021, we saw the share of health aid coming from the US and UK actually dropping from 1.1%, by 1.1% and 5.4% respectively. It is clear that Nigeria needs to invest more, but I'm wondering how sustainable the initial example you gave is. You don't think the government should carry the largest burden in this regard?
Now, to talk about what you first talked about, the international donors, I can summarize it as a missed opportunity, because when the international donors donate millions of dollars to the government, and they are expecting to see a significant improvement in healthcare, and they don't see this, they get discouraged. Another factor, again, that affects it is transparency, and it's not only from the federal government, also the state government, the local governments, independent bodies also. So it is something which trickles down. The federal government alone cannot do all this. But what we appeal to the government to do, the federal, is that they should increase allocation to health sector. We hope that the next one we're going to be having, even if not yet up to 15%, as it was declared in the Abuja Declaration in 2001 by the African Union. And even last year, 2023, about 22 years after, the African Union still re-emphasized that there should be an average of 15% in the budget for healthcare. but we are having average of 5% or less than 5% is something which is worrisome. And I think that the federal government can do more. In addition to the federal government, I still implore the state governments, local governments, and independent bodies like non-governmental organizations. But the problem we are having now and why international donors are not really supporting is because of the lack of transparency among some people whom they donate these funds to. Sometimes these funds are not given directly to the federal government. So that's another thing. Sometimes the international bodies can give to an NGO in Nigeria to, for example, take care of malaria. There was a rollback malaria scheme, polio. So USAID, UNICEF, all these international organizations donate to Nigeria, but not all the time directly to Nigeria. And I'll give you a good example. In the Borno flood now, some people say Borno flood. Well, we don't know the direct implication of this. But we know that millions of dollars were donated. It wasn't to the federal government, to the state government, and also to some locals. And there was an outcry or an outburst on how these funds were managed. Dubai donated, US donated, international organizations, USAID, UNICEF. So how do we manage this? So I'm always reluctant to just always push everything to federal government. I'm always advocating that we as individuals, because I run an NGO and I believe we can work together with the government. And as I said, like what Sheyi is doing independently, we need more people like that to give to the health sector, to contribute. And I believe with that, we're going to have a better health system. There are also some positives I will talk about as we discuss.
I want us to
further.
quickly take a look at the, how do we get ahead of health security threats? Because in the new year, there are still challenges of outbreaks like Lassa fever, diphtheria. There's the sort of mpox and DRC, which the WHO has now declared public health emergency of international concern. What must we do to be prepared? In 2020, we saw a major outbreak that became a pandemic.
COVID-19.
Do we have to wait till something of that nature strikes again? Do you think we're even building sustainable structures to get us ahead of any future outbreak?
Yes, the problem we have in our country is that we politicize many things. For example, in the Buhari's administration, when there was a major outbreak and when there was a pandemic, COVID in 2020, these funds were released by the federal government, released to senators, released to House of Reps members, and to some individuals. What did they do with it? Some of them kept these COVID palliatives. Some of them used it for their parties. Some of them used it for personal use. So this is the problem we are having. Nigeria's problem in health is not only the federal government or state government. I think we as individuals, we also need to reorientate ourselves. An average Nigerian, if they are in a situation where they can help majority of the people in Nigeria, they only take advantage of it for their personal gains. So this is a problem which, even if we keep changing the administration, if a new government comes in, even after 8 years or so, if these people don't reorientate themselves, we'll still have some set of Nigerians that are only selfish and thinking of themselves. And when they are given an opportunity, like funds to treat, to get vaccines, for example, for polio, to treat Lassa fever, to treat mpox, they might just take all these funds and use it for their personal use, and they wouldn't use it for the basic thing. But in primary health care or in public health, the most important thing we look at is health sensitization or health awareness. So people need to find ways to prevent these diseases.
Let's take a short break, and when we return, we'll continue this conversation. Stay with us, everyone. Projections and expectations for the health sector in 2025. We have 5.18% of the 2025 spending plan budgeted for the health sector, a far cry from the 15% recommendation by the Abuja Declaration. With me in the studio is Dr. Yusuf, who's founded Law for Health Organization. Dr. Haroun, thank you for staying the course on the program.
It's a pleasure.
Now, the challenge of keeping Nigerian health workers is also huge. Everyone is trying to, especially health workers, they believe that the job is more lucrative outside. The opportunities for growth to earn more, the poor pay and all of that has been the challenge here. Do you think, I know that, I think it was last year, the National Policy on Health Workforce Migration was introduced, ensuring that healthcare workers get the training and, build facilities and what have you. Do you think we're scratching the surface yet in this regard?
Okay, there's a common saying that it's always or doesn't look green at the other side, or it
actually looks green on the other side until you get there.
Exactly. Now the current saying is that it is green wherever you wet it to be green. So if you actually wet a plantation, it's going to be green. So my suggestion or my recommendation from my own personal experience, I've been away for close to 10 years and back. And I would suggest and recommend that the federal government invest more in health, because Nigerian doctors...
And you worked as a health worker?
Yes.
Which
absolutely.
country?
I worked in Saudi Arabia
okay.
as a health worker for some years. Then I traveled also to the United States, where I also trained in the health system, and I worked there. Definitely, one of the major factors which is affecting our health system, and that is even what we're going to talk about the 1.3 trillion which the President Tinubu put into the health, significantly is more than 1.26 trillion, which former President Buhari did. But because of two main things, we are having persistent inflation and we are having this Naira devaluation, or our Naira is falling, is devaluing, the dollar is rising. So if we want to strengthen our health system, it also has an economic side of it. We need to strengthen our Naira. And a way I think we can do it is that we should use more of Naira. We should add value. There's a particular person, I don't want to mention his name, but he has been advocating on Naira. Buy Naira, live Naira, dress Naira, do things in our own currency. This is a major way we can strengthen our currency. Now about the brain drain, that is what we call it. Brain drain, particularly in the health system, medical doctors, nurses, practitioners, health practitioners are migrating to greener pastures to work there and earn more. It's quite saddening that it's not even only the health sector. For example, I'll give a good example. In abroad, either in Saudi Arabia or in the US, a cleaner can just work for a week. He or she can make up to $500 or more in a week. If you now convert it, current rate is about average $600 is 1 million naira. So that alone would force many Nigerians or even many Africans to migrate outside Nigeria or outside Africa to go to Europe, go to US, some go to the Middle East because of this our currency problem. So I think we should focus more on currency. I know that there's now flotation, and I believe that market forces will bring down this inflation. But we need to first face the elephant in the room, focus on it, and I believe others will come. Then government definitely has to still provide more incentives to the health workers so they don't migrate. For example, housing, feeding, accommodation, also prospects, loans, not even loans, grants even, you give to health workers, and not even only health workers, even general workers, government workers, and people who are willing to stay in Nigeria. I think there should be more motivation for them.
Perhaps to paint a better picture, if you tell us the difference between your experience in Saudi Arabia and Nigeria as a health worker.
Thank you very much. It's going to take a whole lot to say everything, but I will summarize it. Health system in Saudi Arabia, when I was there, was 100% free.
For the citizen?
For the citizens. I'm happy you mentioned that. For citizens, not for foreigners. And in Saudi Arabia, even if you are born there, you can't be a citizen. But if you are in US, if you're born in the US, you can. That's one of the major things. Another thing, again, is that in Saudi Arabia, they are looking for doctors all from Nigeria, India, and different parts of the world. But there is a kind of systematic discrimination. Will I call it discrimination or racism? And I'll give you an example. If you're a US citizen, or you bring a US passport, and you are going to work in the Middle East, Saudi Arabia, Dubai, Qatar, or you have a US degree, and that's what pushed some of us to go to the US to get a degree there. If you have a degree from the US, you are paid more in a country like Saudi Arabia. So that is it. Healthcare is free there. They are looking for doctors from different parts of the world and nurses and health practitioners. Also other fields of practice, they are looking for them. So they have free healthcare, free drugs, free treatment. And I'll give you a good example. There was a particular driver who was a Saudi citizen who is diabetic, hypertensive, and had a road traffic accident. So he fractured his leg. He broke his leg. On the long run, long story short, he had free insulin, he had free surgery, and few months after this accident, which would have been fatal if it was in Nigeria, he was back on his feet walking, and he was elderly.
It brings us to the issue of health insurance coverage and, you know, how much we have done in the past years and how you think we can now begin to bridge the gap in 2025.
Yes, I know there's the HMO, and apart from even HMO, we have the National Health Insurance Scheme, NHIS. We also have current HMOs like IGEA, Redcare, and different kinds of health insurance coming up. But unfortunately, majority of Nigerians cannot even afford this basic health insurance. And this is a problem that we are having in Nigeria. Many people cannot even afford the basic amenities of life, let alone of now going into health insurance. So many Nigerians cannot still afford the health. So I suggest that the government provide a scheme or a method or a means in which we can, or the government can support in this health insurance so that people can have affordable health care, which is a primary role in health system.
The private sector continues to bridge gaps in areas of access and quality as we speak. The private sector accounts for more than 50% healthcare delivery in Nigeria. But do you think we're doing enough to define their role and enable private sector development as a nation?
Yes, this government is encouraging even private sectors. And as I said, there's an individual who was provided 10,000 indigents with drugs. So imagine we have 10 more billionaires doing this, without mentioning names of people. But we have more people investing in health, providing more services to it. A good example is that, look at the banking system in Nigeria. Nigeria's banking system is meeting up to international standards. So I believe Nigeria's health system can also do the same. What I mean is that even when you are outside Nigeria, you can operate your bank accounts efficiently. You can communicate with a customer care representative. You can perform transactions on a mobile app. You can do basic banking, and now with even this digital paying systems, is making things. The banking system is revolutionizing in Nigeria. We also have the entertainment industry in Nigeria, which is going of international standards. They are winning Grammys. We also have the actors and actresses in Nigeria. So all other systems in Nigeria are going at a fast pace, but the healthcare system is still crawling as a baby.
So we're a long way from where we should be, and especially now that we are short about 10% of our annual budget spending on health. We look forward to see how this government bridges that in the coming months. Thank you so much for your contribution. Founder, Love for Health Organization, Dr. Yusuf Haroun. Thank you for joining us.
It's a pleasure. Thank you very much.
And that's our show today, everyone. Thanks for being a part of it. We're back again tomorrow with more. I am